Health for Life. This is the first ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
Now, June from New Amsterdam is asking a question about fertility. And what I found, and I'm sure you have experienced this, is that the knowledge of our average young Guyanese women about their menstrual cycle is not where we would like it to be. So spend a few moments on what about the menstrual cycle? When are the most opportune times for a woman to become pregnant?
Unfortunately, it is not as easy as it might seem, but let's try to simplify it a little bit. When we look at the menstrual cycle, we are talking about the time from one period or one time of bleeding to the next one. That time is usually about 28 days, varies between 25 to about 35 days. It's going to be a little longer, a little shorter with different women. In between that time, there is when the body is going to release an egg or ovulation is going to take place. That time is generally about 14 days before the period starts. And when that egg is released, that egg lives in the body for something like 24 to 36 hours. So that is the best time for that woman to become pregnant.
Okay. Now, in terms of C-sections, two questions about C-sections. Amanda from Kitty has one question, which is, does having a C-section limit the amount of times you can get pregnant? And I wanted to add another question, which I've heard often. If you've had a C-section, can you deliver your next baby by a normal route?
Let's deal with the second one first. Answer to that is simple, yes. However, we need to add to it that it depends on what is the reason for the cesarean section. Okay. So what we should say is yes, providing the reason for the cesarean section no longer exists. Let us say, for instance, we decide to do a cesarean section on a patient because there is damage to her pelvis. Let's say she was involved in an accident, she fractured her pelvis, and there's a problem with the pelvis. So she had to have her first cesarean section, or she was born with a problem in the pelvis. For that reason, we had to have a cesarean section. Next time she becomes pregnant, she still has the problem, so she should still have a cesarean section. On the other hand, we usually say that if the first babies come in bottom first or come in breech, then that person should have a cesarean section. There's some people who even say that once the babies come in breech, you should have a cesarean section, and that's an academic discussion that we're going to save for a next place. The first one come in breech, you decide to do a cesarean section. The second one not come in breech, you could have a normal delivery, okay, and so on. So once the reason for the first cesarean section still exists, then we need to do an next cesarean section. If it don't exist, then we don't need to. How many cesarean sections we can have? What we find is that in many institutions, in many places, you have what I like to call institutional policy. So they say in many places that you should not have more than 3 cesarean sections. Okay. That is more of an institutional policy than an absolute rule.
Okay.
The reason why they do that is because you have many different people working in an institution, people of different grades. And to do a 3rd cesarean section or any subsequent one after that could be particularly challenging. So they would even have rules in some institutions that to do a 3rd cesarean section, you must have a person of a certain level, a person of a certain seniority. And these rules have been carried over and are used elsewhere. But many of them are there because of they are more institutional rules than general medical rules or obstetric rules. When it comes to an obstetric rule, what we say is that the number of cesarean sections you have depends on what is present. So when we do a cesarean section, one thing we like to look at is what is the nature of the lower segment, and based on that, we might decide that we might need to do a cesarean section again, or you might not need to. But it's not an absolute rule.
Viewers, we are running short on time. I know many of you have additional questions. Please find us on Facebook, where we will take the rest of your questions. Dr. Roberts, thank you very much.
Pleasure, man.